Our next guest is Dr. Bharat Pankhania, who is a COVID expert. He's been featured on CNN and BBC and Sky News and many other news channels. So here he is, Dr. Bharat Pankhania. So good to see you. How are you?
Very, very well. Thank you. And it is wonderful that the internet can connect us and our people and share good knowledge and practice with everyone. It really is a pleasure.
It's so amazing, especially being part of Healing Our Earth, to see so many doctors and specialists and scientists all around the world just collaborating and bringing this information to the viewers. And I love watching you on all these news channels, sharing your great knowledge. So thank you so much for your time to be here on Healing Our Earth and share your knowledge. It's a very exciting time there, Dr. Bharat. The vaccine has come out, right?
It is an exciting time, and my excitement is at multiple levels. So the multiple levels of excitement is, whilst we have invented a vaccine for SARS-CoV-2 virus, coronavirus family, the other benefits are that we should be able to make vaccines against other infectious diseases, as well as other conditions like cancers. So I'm really looking forward to becoming younger again, if only I could, and go back 30 years. And in the next 30 years, we will see amazing advances in technology for treating common illnesses like dengue fever, malaria, a better TB vaccine, a better influenza vaccine, better vaccines instead of antibiotics for the treatment of common illnesses, because we're running out of antibiotics now, and also therapeutics like cancer treatment, and also therapeutics like genetic disorders where we don't make the right protein, and therefore we have conditions like cystic fibrosis, etc. So it's a marvelous world to be in, the world of science today. It's a good day to celebrate science and technology.
Don't we all wish we could be 30 years younger?
Yes.
The exciting part about this virus is this vaccine that's come out. It's an mRNA vaccine, which is a very, very different kind of vaccine. Can you just explain to our viewers what exactly is a vaccine and how does it work?
Yes, it's my pleasure. So we pay homage, and as we would do in Indian cultures, that when we have a lovely person who invents something, we make a gold statue of them and we venerate them. So in this case, we need to venerate a chap called Jenner, and he didn't live very far from where I am here in Bath. So he was a physician in Gloucestershire, not very far from my home at all. And he noticed, this is the important bit, he noticed that the ladies who looked after the cows who had what we would call cowpox, yeah, they suffered mild or minor or no illnesses from smallpox. So he took that theory forward and thought, I wonder if because they're exposed frequently to cowpox, that they're developing something called protection against smallpox. So he took that hypothesis and inoculated, sons and daughters of rich farmers, etc., and noticed that they were protected. So that is the birth of vaccines. Jenner invented it. And so coming on to many years later, 2020 today, and we come to the mRNA vaccine. So before I go on to the mRNA vaccine, we have to also pay homage to people like Watson and Kirk and Crick and others who discovered DNA. And having discovered DNA, and then we made other discoveries, like there are other components called RNAs, and then let me start again. So DNA stands for deoxyribonucleic acid. That is the code, the absolute code that determines the color of your hair, the color of your eyes, how tall you are, how short you are, how fat you will be, conditions that you will develop. All those codes are in the DNA that you are given at birth. And then there are other components like messenger RNA, mRNA, and RNA, ribonucleic acid. And ribonucleic acids are parts of the DNA, but they're not the DNA, to keep it simple. So finally now then, we come on to the mRNA vaccines. What are they? What does it do? How does it do it? Well, the mRNA, the M stands for messenger, and the RNA stands for ribonucleic acid. What they do is one thing, and the key is in the word M. It's a messenger. Its instructions are, I bring you a message. Actually, it's not a message. I bring you a message and a instruction. So the message and the instruction, one and the same thing, is, can you make this protein? No more, no less. And in fact, it isn't a can you, it is a will you. No, it's not even a will you, you will. So it enters the human cell. Let me go back a little bit more. So we deliver this mRNA to the cell, and not the nucleus, not the DNA. There is no interference with the DNA, none whatsoever. It only does one thing. It enters your cell, and in your cell, it tells, machinery like ribosomes, which are little components in a cell, to do things. So the RNA enters your cell, and it asks your cell to make spike protein. That's the instructions. It asks it to make the SARS-CoV-2 spike protein, and that protein is expressed. What does that mean? In other words, they make these little bits and pieces of protein, and then they show it. It's like little projections from the human cell. In other words, it appears on the surface of the human cell, having manufactured it. Having manufactured it, your body's immune system, that's the surveillance system, that's looking out for abnormal things, unusual proteins, etc., proteins that don't belong to your body. It recognizes it and says, oh, I know you. Well, it doesn't say that I know you, but it says, this is alien. This is not meant to be here. I don't like you. I'm going to make antibodies against you. So it makes antibodies against the spike protein. And it also makes immune memory against that spike protein. So it remembers that if you come back again, I will remember you, and I will produce lots and lots and lots of antibodies and also cellular immunity very, very quickly against you, the virus that comes next time, and I'll eliminate you. So that's how the mRNA vaccines work. They basically are an injection. It tells your cell to make spike protein. Your body recognizes the spike protein and says this is alien, and against it, it makes antibodies. And it also makes immune memory so that it remembers, I know you, I'll look out for you if you come back again. And that's how immunity works, and that's how the mRNA vaccines work.
Wow, that was a great explanation, and I think a lot of viewers would really appreciate that, because there is a lot of concern out there because it is a newer kind of vaccine. Even though I know Moderna had done like 30,000 trials on it, and Pfizer 44,000 people have been already tried on these vaccines. But there is still concern because it is so new. People are worried about, does it affect their DNA? Can you talk a little bit about the common concerns that people have, and just some explanation, please?
Yes, sure. So people say, I don't want anything that interferes with my DNA. And of course you should be concerned. Of course. So it is good of you to be concerned, and good of you to ask those questions. And my answer is as follows. The messenger RNA only does one thing. And the one thing that it does is it enters the cell. And I want to talk about how does it enter the cell, because that's really good stuff. So make sure you ask me that question in case I forget. So it enters the cell, and it does have nothing to do with the nucleus. And it is the nucleus where the DNA is kept and looks after the cell and everything else. So the nucleus is not at all involved in this process. And what it does is it instructs little bits in the cell called ribosomes to make the protein and nothing else. So, and then one more thing, it's almost like it's almost like salmon leaving the sea to swim up the river, all the way up the river, all the way up the river where they were born. And where they were born, they will lay their eggs, fertilize their eggs, and die. That's what a salmon does. Its job is finished. It was born in the river, it went out to the sea, and then it matured, and then it came out of the sea into the river, all the way upstream. And at the end of the upstream, it laid its eggs, fertilized them, died. Same with the mRNA. It arrives in the cell. It does nothing else. It cannot reproduce. It cannot multiply. It cannot touch your DNA. It doesn't do anything. It can only do one thing. The one thing it does is it makes spike protein. So eventually the mRNA degrades. In other words, it becomes non-effective. It can't do anything, and it's just destroyed and digested up and finished. So it comes, it instructs your body to make a spike protein, and then its job is done. And then your body's own immune system takes over and makes antibodies against the spike protein and also remembers it. One more thing. So you could argue that you could cause a hyperimmune response by giving a lot of messenger RNA. Very valid point. And my answer is, this is why we make sure we give you what we would call in trials, a sensible dose, so that your body doesn't get a huge dose and it makes lots of spike proteins and then hyper stimulates your immune system. So there are checks and balances and safety measures about how big a dose to give and how big a dose is a safe dose, how low a dose is low enough for us to get away with. These are all parts of the experiment, and you find a middle order which is safe to induce immunity and safe enough not to cause hyperstimulation of your immune system. Does that answer your question?
Absolutely, it does. When you talk about hyperstimulation, the concern I have then is you'll give your first people that you want to give the vaccine to are the healthcare workers, and then those at high risk, which are the elderly. So is there going to be a concern with the reaction of this vaccine to the elderly people? We don't want to give it to them and then cause potential bigger issues like death, for example.
Yes, of course we should be concerned. And then the checks and the balances and the monitoring is there. So as we get older, everything gets worn out, including your immune system. So when we give these vaccines to the elderly, old, frail, other illnesses people, they don't mount a very good immune response. They do mount an immune response, but it isn't a supercharged immune response. So often what happens with the elderly people is you don't give them a big dose. That's not what you do. No, that would be wrong. But what you can do is you say to your operations is we will monitor you. And if you are making suboptimal immune responses, we will give you the smaller doses frequently. In other words, we'll give you 1, 2, 3, maybe 4 priming doses to make your immune system wake up, recognize it as a foreign protein, and make immunity to it and immune memory. So that's how we prime and super prime the elderly. Now then, with the elderly come the care workers who look after them. So the care workers are usually young, and these young, fit, able people will invariably make a better immune response. And the other thing is this. So like take my mother, she's elderly. She doesn't go clubbing or pubbing or shopping or dancing or whatever. She's at home. She's doing nothing. But if she had carers, then her carers would be, and rightly so, being going out to have dinner, pub, club, socializing, etc. So they are interacting with a lot of people. And because they're interacting with a lot of people, she could bring the infection to my elderly mother and infect my mother, who's done nothing. And then my mother would have severe illness and may die. So what we do is we protect my mother, elderly, with the vaccine, and we protect my mother from people who could potentially infect her, that is the carers, and give them the vaccine too, so that they don't introduce it to my mother, who may or may not make a good immune response. So, but what you're effectively doing is creating a shield for the elder person, and all the people who are around that older person, they're also hopefully protected from being infected and infectious against the virus. And that's why we immunize them too.
So that sounds great. That means that the government needs to really strategize how to give this vaccine. For example, like if you have elderly people in the home, to make sure that the people that are in the house are getting vaccinated.
Well, yes. So whilst the care workers and elderly people in nursing homes will be priority number one, elderly people living at home with other people are not priority number one. So priority number one will definitely be elderly people in residential homes where they are mixing with carers. But actually, what will happen is, because to begin with, there's always a shortage of vaccines. So we will immunize elderly people in hospitals, elderly people about to be discharged home, and then care workers. So we immunize quickly the people that we can immunize very quickly. And then we have to work out how are we going to immunize people in nursing homes. That's a logistics nightmare, because it's not possible to bring the vaccine to them, to their homes. So what are we going to do? We got to work it out. I can imagine that's the logistics nightmare of getting frail, elderly, vulnerable people out of the nursing home to go and get immunized, or wait for a vaccine that can be brought to them. The AstraZeneca Oxford vaccine is the one that can be brought to them.
It seems that there is going to be a bit of a logistical issue at the beginning, because of these vaccines have to also be kind of kept at a very cold temperature. Isn't that right, Dr. Bharat? So just getting a lot of big freezers and fridges around to hold so many vaccinations is going to be an issue. Do you see other logistic issues that are going to be
Yes,
presented?
there are several logistic issues. So one is it starts its journey and it has to be kept at -70. Second, after you have thawed it and it's at room temperature, you have to use it. So you have to use large batches in one go. So you can't be wasting vaccines. So, when you are defrosting a box of 975 vaccines, you better use 975 immunizations for the box that it came in. So that is a nightmare. I do know that once it has been thawed, the vaccine can be, stable for up to 5 days. So what can happen and what may happen is, at the hospital's hubs, it is safely thawed and then safely, carefully transported to local areas like GP practices, where the vaccine is administered within a very short window, whilst the vaccine is still stable and it hasn't degraded. So the stability lasts for up to 5 days. So those are the things that will have to happen. A lot of headaches, really. So I'm really looking forward to when the AstraZeneca Oxford one is licensed, so that we can then immunize thousands of people in a short time.
So with the fact that there's so many different vaccines out there, is that going to be a concern for some people who are going to be like, oh, I'd rather wait till that vaccine comes out? I mean, how do you even pick from vaccines? Are they all going to be quite similar in what they do so that you're not kind of like shopping for vaccines?
Yeah, I wouldn't shop for vaccines. Once they have been licensed, they have passed the line of safety and efficacy. So what I want is a vaccine that's safe and effective, and there's no point in shopping around. They all do the same job through different means. So let me dwell a little bit on the AstraZeneca Oxford Group vaccine. We call those vaccines a vector, and the vector is basically like a mosquito is a vector. A mosquito doesn't cause malaria, but the plasmodium inside a mosquito's saliva is the thing that causes malaria. So we call mosquitoes a vector for transmitting the plasmodium into your bloodstream. So similarly here, what we have, the vector is a chimpanzee common cold virus. So it's a chimpanzee common cold virus which has been altered to not be able to replicate. Okay, so that's the vector. It carries instructions, and I'm coming on to the instructions in a minute. So chimpanzee common cold virus altered so that it cannot reproduce. Step one. Step two, attach to that virus a instruction. Now we're getting similar to the mRNA. So you attach to the chimp virus that you have denatured a instruction, a mRNA. And the mRNA does what an mRNA does. I've been through this before. So you give the AstraZeneca Oxford Group vaccine, and the virus, the altered chimpanzee virus, carries the mRNA into your cell. And having carried it inside your cell, the mRNA does what an mRNA does, make spike protein, and then body recognizes it and it makes immunity, etc. So you see the technology. One is the mRNA from Pfizer and Moderna delivered as a nanoparticle into your cell. It's a tiny, tiny, tiny particle, 10 to the minus 9, and it is coated in lipid, and it enters your cell that way. The AstraZeneca Oxford one enters the cell carried by a chimpanzee virus that has been altered.
See there, you did remember to tell us how it entered the cell. I didn't need to remind you.
Indeed.
So what about the vaccine booster? So when you take it once, you're going to have to wait a little while and then take a second booster. And what happens if you forget to take the booster shot?
Well, you need to try and not forget, because it is in your own interest to have maximum immunity against this thing. And not only maximum immunity, but maximum immune memory. Immune memory is important. So you need to have steps taken to write down on a good piece of paper that you're not going to lose, date vaccine given, and then the date for the second one, and note down which one you received and where you received it. Irrespective of what the people are going to be doing for you, they will probably give you this piece of paper. But I'm saying, do your own due diligence. Write down on a good piece of paper, in other words, a notebook. Where did you receive it? When did you receive it? What did you receive? What date? Etc. Just write it. What date is the next vaccine? Write it down so you don't forget. So, okay, accidents do happen. Don't worry about it. So say you had the vaccine today on the 1st of January, and on the 21st of January, you were supposed to receive the second one, and you forgot. Don't worry about it. Maybe you remembered it in February. Maybe you remembered it in March. It doesn't matter. Go and have your second vaccine. It's late. It's not too late. Okay? Go and have your second. And then there will be people who've traveled and moved countries and they can't remember if they had the vaccine or not. What to do? What to do? Nothing. Don't worry about it. Relax. Have the vaccine. It's not going to do you any harm. So, for example, I immunize against the measles, mumps, rubella vaccine infections with a vaccine. People often tell me, I can't remember. And I say to them, listen, if this is your third or fourth MMR, it's not going to harm you. All it's going to do is boost your immunity. So don't worry about it. Okay. Every day when you go out on the red bus to work, you're meeting thousands and thousands of bugs anyway. So every day you're encountering antigens anyway. I appreciate in a vaccine, it is in a concentrated form. So don't worry about it, is the shortest possible answer I can give. But do your due diligence, write it down in a nice notebook so you don't lose it. So it's a good record of what you had, when you had it, and when your next one is due. And I was asked this question, can I swap around? And my answer is this. Ideally, if you start on the mRNA vaccine, finish the course with the mRNA vaccine. If you start the course with the AstraZeneca vector vaccine, finish the course with that one. So keep it same.
Oh, thank you. That was great advice. With the vaccine, there's a couple of questions. So what happens if somebody already's had coronavirus, COVID-19? Do they still need to get vaccinated, or is this going to kind of just help boost them up a little bit more as far as the immunization?
Yeah, that's a lovely question. And this is a question of, it is a conundrum. And I don't think the experiments were done on giving people the vaccine who have already had the infection. So what are the concerns? So if I were to immunize somebody who had it, will I do them any harm? That's the first question. And thinking empirically, I don't think so, because all you would be doing is boosting their immune system post an infection. So empirically thinking from first principles, I can see that it could be pretty safe to do so. But I would like to see proper experiments conducted in saying, yes, we took 1,000 people who have survived a coronavirus COVID-19 disease, SARS-CoV-2 infection, and we immunized them, and we found that there was no untoward outcome. So I'm pretty sure these experiments are happening now for us to have absolute proof that it is okay to immunize people who've already recovered from COVID-19 disease. If I was in the middle of an outbreak with very few things that I can do, middle of a jungle, difficult country, that sort of thing, I would err on the side of caution and say, take the vaccine, even though you've had the infection.
And what about, let's say, so there's so many people that actually have COVID-19 right now. And let's say you are actually currently infected and then you get the vaccine. Is that going to be just so much for the body that it could be potentially fatal? Or
no, not at all. And this is a very important point. Parents often tell me, but sir, you're going to give my little baby 5 vaccines. 5. Isn't that going to overwhelm their immune system? And my answer is, but when you go out on the red bus to school or wherever, you're meeting thousands of antigens every day. I'm only giving your child 5 compared to the thousands you're exposed to every day. And your immune system never gets overwhelmed by just normal life. So I don't think just because you've had a recent coronavirus, COVID-19 disease, SARS-CoV-2 infection, that soon after your infection, a few months, I give you a vaccine that it will overwhelm your immune system. I don't think so.
Got it. Thank you. Let's just shift the conversation a little bit to, there's a vaccine out. So now, do you think a lot of people are going to get a little bit lax and just be like, oh, it's time to party because, you know, we're like at the end of the tunnel? What kind of advice would you like to give the general public about staying safe currently right now?
Well, they have endured 2019 in a 2020 difficult circumstances, and many have lost loved ones too. And this is a serious illness. So I would say have some patience, have some resilience, and this is very important that you are alive. And the reason why it's very important that you're alive is we have a job to do. One, we have to celebrate many things. We have to reset how we live our lives and hopefully live our lives in a better way, environmentally, culturally, cooperatively, and so many things. And finally, I also say we have to hold certain politicians, etc., to account for how they managed or mismanaged the coronavirus COVID-19 pandemic. So there are many, many, many reasons to remain alive. And so one measure you can take is don't get infected, don't infect others, because there's a job to do. Life, if you're dead, you're dead, you're not coming back, it's finished, you know? So why finish your life if you can help it? So remain alive. There's a beautiful world out there to enjoy. And, you know, I think nice things are going to come out of this 2020 suffering. Don't get infected, don't infect others.
Dr. Bharat, let's just quickly go through those precautions again. We all know them. They're wearing the mask. Let's just run through that again. Just give the viewers some good advice that they just need to go through for the next couple more months until vaccine's out and we can kind of start getting some normality.
So it won't be a couple of months, and it is better that I'm honest. It's more like 3 to 6 months, okay? At least. So brace yourselves for it. Avoid contact with too many people. That's the ingredient number one. People, you see, you might think that Mr. John Smith is only interacting with you, but you don't know how many other people that John Smith is interacting with, and so on. So you keep your circle nice and tight and small. Important number one. Number two, when you go out and about, only humans within reason, unless you're a mink farmer or something like that. So within reason, only humans can infect you. So when you go out and about amongst fellow humans, consider, and this is something I said, I made headlines. And at that time when I made headlines, people raised their eyebrows, but now they accept it. So 7th of March, 2020, I said, and I stick by it today, consider everyone, everything at every time to be potentially infected and infectious, and tread carefully accordingly. So when you go out and about, have that in your mind. Everyone, everything, every time, every place is infected. So what do? Wear your mask. Wear your mask properly. And I mean, when I say properly, I mean, pity I haven't got my mask here by me. It has to go up here, not over here, not over here, not here, not here, not here, not there at all, but here. So starting from here, it has to cover your nose and mouth properly and snug fitting. And when you wear your mask snug fitting properly, you're doing yourself a lot of favor, a lot of benefit to you personally. So wear your mask and it will protect you. I know you're protecting others by wearing your mask too, but most people are only interested in themselves. So I'll focus my attention on themselves. Wear it properly. Second bit, keep your distance from people. I've already said this. Then the easier bits are keep your hands clean. And one way to keep your hands clean is to use the alcohol gel when you can't otherwise wash your hands. But my better advice is timetable washing your hands, and wash your hands every 2 hours and dry them. So it's not only washed hands, it's washed, clean, dry hands that work. So you dry them properly with a paper towel or a towel. So it's washed, clean hands, nice and clean them properly, and they will do the job for you. But even if your hands are not clean, because you can have a lot of dirty hands, and I say this, it's not the dirty hands that make you ill, because this hand can be filthy dirty. It's if I do this and introduce my hand to my nose and mouth, that's when I get infected. So learn not to do that, and avoid close indoor places. That's the important thing. So there is a Japanese one, and this is a very good piece of advice from Japan. So it's the 3 C's: close crowds, close environment, and ventilation. So you need to avoid crowded places, close contacts, and closed places. So closed places, crowds, and close contact. If you can avoid those 3, you're already onto a winner. Plus wear your mask properly.
Thank you for going through that mask hygiene again, because a lot of people I'm noticing, they're touching the outside of their mask, which could now be contaminated with virus, and then they pull it down and then they're scratching their nose. They don't realize that that's a potential source of getting the coronavirus.
Yes, indeed. So you are right. And you, as my fellow medical colleague, dental colleague, you will understand that when we were taught all these things, we put on our gloves, and those gloves never touched anything apart from the patient. And then when we put our mask and gowns on, we didn't do this and we didn't touch our gowns. So similar advice here is you can't be handling your mask and then expecting that your hands are clean. But you need to keep your hands clean or reduce handling of the mask. So how do you achieve all of that? Well, it's easy. You put your mask on and you keep it on and forget about it. And if you put your mask on properly, as you know, in the middle of surgery, you can't be changing your mask or altering it or touching it or anything. You know that. So you will make sure you put your mask on properly. And once it's there properly, nice, tight and snug, it won't slip, it won't move, and you won't have to adjust it. And if you have to adjust it, which you might have to, then you also know that your hand is potentially contaminated, and a little dab of alcohol gel to keep your hands clean is a good practice.
Well, thank you for that. And one other thing I'm noticing coming from the medical background is just disinfection. Like, you'll notice that disinfectants need a certain amount of time to actually kill viruses. And I see it kind of just sprayed and then wiped very quickly. I feel like there needs to be more education out there for restaurants, for example. In the hospital, I think we're doing very well, but general public don't understand so much. And even like restaurants and shops, just to have us be able to kind of, when we do go back, to be safe.
Sheila, you're so right. And I observe this all the time. And what I sort of feel is, goodness me, we don't teach science very well at all. And I despair, because I'm a scientist and I want other people to know science as well. So you're absolutely right. You spray, as you said, and then you wipe clean. And that's rubbish, really. So if you are going to be using proper disinfectants, then you need appropriate contact time. So you spray and allow that contact time to elapse, and then you wipe clean. Otherwise, you're ceremoniously spraying and wiping clean, often with a dirty cloth. And that dirty cloth is taking muck from table 1 to table 2 to table 3. So my best advice would be spray, contact time, wait, in other words, and then with a disposable towel, wipe that table, and then throw that towel away. Next table, do the same. Or if you have 10 tables, you do spray the 10 tables and then wait, and then you go table 1, 2, 3, 4, 5, 6, 7, all the way to 10, wiping them clean 10 times with 10 different pieces of disposable towels. And that would also give you the contact time by the time you reach the 10th table, so on. It can be done. You just need to be aware of why you spray and what you need to do. By the way, I'm in a very privileged position. So I'm advising local authorities on infection control practice. And I'm using my knowledge, skills, and expertise to tell local authority, to tell the restaurant business, etc., how to do it properly. So I feel very good that I'm in the front line, although I'm a backroom boy, that in the front line, I'm making sure that not only do they do it, but they do it properly.
Wow, thank you so much, Dr. Bharat. There's so much information here. I know we could be chatting for like hours and hours and hours, which we have done offline. There's just so much to talk about, and just knowing that the vaccine's coming out, there is some hope, and there is light at the end of the tunnel. So thank you so much for your time. And I know that you're very busy on all these social media and different TV channels. So we're very blessed to have you here on Healing Our Earth. How do we follow you? How do we kind of get some more information about the work that you're doing?
Yes, thank you for asking. And this is important because I also learned that if people had been following me on Twitter, for example, they would have seen the chronology of things happening from February to today. And with me, they would have been learning. So I would like people to follow me because I think there is a bank of information here. And if you will put it up, I'm very grateful to you. So on Twitter, I am at Dr. Saib. So it's DOCTORSHAIB. Okay. And then whenever I can, I also try to put everything on a YouTube channel. And the YouTube channel is Dr. DOCTOR Bharat, BHARAT, Pankhania, PANKHANIA. So if you put all those, Dr. Bharat Pankhania into YouTube, you will find who I am. Subscribe. It's good knowledge. Every day I post a new interview there, and collectively people will learn and be educated and reassured. Reassured is very important to me.
All right, Dr. Bharat, give us your final tip out there, just a final thing.
Well, vaccines are almost there. Hold your ground, and simple thing. Don't get infected. Don't infect others. Wear your mask properly, and look forward to 2021. Good times are not far away.
Thank you so much, Dr. Bharat. Thank you for your time.